page 6, page 7, page 8. If everyone's comfortable with that, will you show your hands? Thank you. Any against? Any abstentions? Thank you, Councillor Marfleet. Now move on to agenda item number 4, which is an action log of the previous items. Are there any comments that anyone would like to make? Michelle? Pete? No? All right. Chairman's announcements, item 5. I'm assuming that you've all read these, but I just want to add a couple of extra ones. One is that John and I have agreed that we will take part in an interview with NHS Confed. It's in conjunction with the LGA around what's next for ICSs. And the other is that at the end of this week, I've been invited to a meeting with the Minister for whatever, Helen Wakely, who, well, I don't know what she is, Minister for something, isn't she? Again, to discuss ICSs and where we are now with them and where they need to go. So I will feed back to you at the next meeting. We don't need to do any hand raising for Chairman's announcements, do we? No. I'm sure they are. Item number 6, the integrated partnership terms of reference. I'm going to invite Michelle, if you would like to update us on these. Thank you.
Thank you, Chair. So I won't take you through these exciting agenda item, but it is a formality. We've been in existence now for 12 months, so I'd like to thank everyone for their commitment and hard work, appreciating the coterminous nature means that we've had to be quite creative with how this fits with our Health and Wellbeing Board. So we have updated the terms of reference and we've extended our membership and invited Melanie Weatherly from our care sector to be part of the group in order that we can ensure that we've got a full representation of the whole care system. And thank you for Melanie to agree to do that, so welcome. And as you know, we've also aligned our membership to our Health and Wellbeing Board, and so any changes to the Health and Wellbeing Board are reflected in this membership. The only other thing just to highlight is at the start of our ICP, 12 months ago, we obviously nominated our chair and vice chair for the council and the ICB, and what we've agreed to do is replicate our Health and Wellbeing Board, and we will only update our chair and vice chair if the chair and the vice chair of the Health and Wellbeing Board is changed, as that goes through a formal council process. I'm happy to answer any questions on any other technicalities, however, pretty much all of the other remains unchanged. So thank you.
Thank you, Michelle. Melanie.
Thank you, Councillor. I just wanted to say thank you for the invitation to join. We are in a very small handful of ICPs that have care sector representation on them. So once again, Lincolnshire is leading the way.
We're special, that's the reason. Any other questions or comments? Julia.
Thank you. Just might sound like a technical point. So when you say that the ICB is the same as the Health and Wellbeing Board, so I know that on the Health and Wellbeing Board I don't have voting rights, but I thought on this one I do, and I just want to double check that as a constitutional issue, please.
Yes, so the Integrated Care Partnership, the ICP, is different from the ICB, so the Integrated Care Board. So just so on the ICP, that's where we are today. We've replicated the membership and aligned our ambitions to our Health and Wellbeing Board, but the Health and Wellbeing Board operate under as a committee of the council. We are a separate committee, a joint committee, so everyone in here has equal rights. Hopefully, as a partnership, we would never come to the position of a vote because we'll hopefully all be in collaboration, but you would have equal rights at this partnership rather than be an associate member of the Health and Wellbeing Board.
Thank you. I didn't want to appear rude if I didn't put my hand up or down.
Okay. Any other comments or questions to Michelle? Okay, we will then move to the actions, which is to reaffirm the Integrated Care Partnership Terms of Reference. If you're happy, will you please raise your hands? Anyone against? Any abstentions? Thank you. We move on to item 7, which is the winter planning 23-24. And I'm going to invite Claire Raybould, who I understand is on the screen, hopefully, and Afsana. It's a joint presentation.
Yes, thank you.
Okay, thank you. Well, in that case, I'll pass straight over to you.
So Claire and
I think I'm going to. Oh, sorry. I thought you were passing to me, Councillor Woolley. Sorry.
Sorry about that, Claire. I've got you behind me, so I can't
Behind
see
you,
you. I do
I
beg your
know, yeah.
pardon.
No, that's fine. Do you want me to start, and then I'll pass to Afsani? Is that okay?
Yes, please, if you would. Thank you.
Okay, yeah. So afternoon, everybody. I'm Claire Raybould, the ICB Director for Service Delivery. What you've got in front of you is the winter paper today, and it's a bit of a double act between myself and Afsani. So we'll take the paper as read in terms of the detail. It provides an overview to you of the winter planning guidance that we've received for 2023-24, which clearly articulates the expectations of us and the steps taken so far to date. We are in the midst of our winter planning at the moment. In fact, several colleagues from across the system are today at the regional launch of the winter planning event that's happening out in Staffordshire. We're clearly anticipating winter to be challenging, as was the last one, on the back of a very busy summer for health and care, but also in the context of ongoing and escalating industrial action. You'll know that next week we've got 3 days of joint action between junior doctors and consultants, and we're expecting that to continue through the winter period. So that has significant impacts on our service, but also significantly on users of our services. So the plan builds upon the Lincolnshire Urgent Emergency Care Recovery Plan, which details all of the high impact interventions that we're undertaking in Lincolnshire already. It asks us to complete operational surge planning at system level. So we do it at provider, but also at system level. It expects that the ICB has effective system working. We've got great system working across Lincolnshire that the ICB doesn't need to effect really, because it happens by nature of the partnership approach that we've got across healthcare and voluntary sector across Lincolnshire. And there's a focus on workforce in terms of well-being of our workforce, making sure everybody's vaccinated, and the kind of people promise that exists for our workforce across the county. So planning for winter started actually in our normal planning round for this year. So unusually we didn't get a specific winter allocation like we did last year. What we were given was an allocation at the beginning of the year, which was for urgent and emergency care demand and capacity. So that's been augmented by some specific winter planning, which we started in August across the system, and has been a collaborative approach. There's several new recurrent services that have been designed to commence for peak periods of winter, such as the acute respiratory infection hubs. We didn't have those last year, and we know we saw a spike in respiratory infections that we could have managed differently in the community. Frailty assessment and frailty same-day emergency care. Again, we know the cohort of our population and that we could manage them differently, whereas previously the only route for those patients largely is in acute care. And then we've also enhanced services that we've already got in operation. So colleagues will recall the active recovery beds that we put in last winter. So we've put them in for the year, and we've got them increasing in number at peak winter, so the last quarter of the year. And the transfer care hub, which is a collective effort across health and care. We're moving that to 7-day working and enhancing the staff that are working in that to support us all year round, but designed to kick in ready for winter. In addition, we've had some slippage from some of our recurrent schemes this year, so we're deploying that where we know it will make best effect for winter, although that is obviously in a non-recurrent nature. And we've just had agreement this week, actually, as part of the winter planning that we did the first round. We talked about how do we make it easier for health professionals wherever they are in the system to access the variety of services that we've got available. We have a lot of admission avoidance and services in the community. But if you're a health professional with a patient in front of you or a service user in front of you, and you need to do something different, it's quite difficult to navigate that really quickly. So we talked about having a single point of access for clinicians or care staff. So we already have it for care homes for clinical assessment, for example, but we talked about how could we make that really easy for people and our health professions across the county. And we've just had this week confirmation that we've been given some funding to do a pilot over winter for that. So that's really quite exciting for us to get in with. The report does reference that the Lincolnshire Winter Plan has been submitted to NHS England for approval. My apologies, that's not quite correct. So what we did submit was, you'll see in your pack, you've been given a key lines of inquiry blank document. So we were asked to submit one of those to the regional team, which is what it refers to, rather than the actual winter plan, because that's not yet been written. So we're currently in the process of doing that. We were required to submit a further iteration of that key line inquiry document actually late yesterday, following feedback from the regional team in terms of our plan so far, or our key lines of inquiry that they're asking us about so far. That the content of that will form the basis of our winter plan, but obviously has a lot more content that wraps around it. And that will be drafted and taken to the Urgent and Emergency Care Partnership Board on Friday next week for sign off by the system. But as we did last year, it will remain an iterative document. We also, as you can see in the document that you've got in front of you, we had a winter task and finish group last year that sat within the urgent and emergency care governance. Whilst we sit it there, we know that the winter plan isn't limited to urgent and emergency care. For example, we've got a responsibility to maintain elective and cancer care, which is of equal importance to our urgent care pathways. We continue to operate a winter oversight leaders group every Tuesday night. Both Afsani and I are there, and I'm usually chairing that meeting, where we keep track of where we are in terms of live delivery of our winter plan and any course corrections that we need to do during the winter months. So I'll pause there, Councillor William, and hand over to Afsani to add some bits she wants to share with you.
Thanks, Claire. Afsani.
Thank you. I'm Afsani Saburi, Assistant Director for Frailty and Long-Term Condition. Thank you, Councillor, for the sorry for the time. I think Claire covered most of the important points in preparation for the winter. Just wanted to touch on adult social care position and within the winter plan. As Claire mentioned, we were advised by Department of Health and Social Care that we needed to focus on four main high impact interventions, and we agreed as a system that it would be intermediate care, virtual wards, acute respiratory infection, and frailty. Intermediate care, you may be aware that we completed a review, and the proposal was presented to be led and signed off by chief executives, and the first phase started during the summer, focusing on bed-based contracts and merging the current beds by using a pool budget and outcome-based specification. The hospital at home virtual wards is enabling patients to get hospital level of care home safely, and the rounds or video calls or home visits depends on the severity of or the complexity of the health condition, and it's not just for the doctors. Allied health professionals can also use that opportunity. We have been extending our OT occupational therapy integrated therapy service, whereby we working with LCHS, the community trust, and if residents is on both waiting lists, the OT who goes from us, local authority, or the community trust will do both. So the residents don't need to repeat their stories, and we are ensuring that we have enough resources, workforce is empowered and in the full capacity for the winter comes to come. Hospital admission avoidance, we have Heart. Age UK is an initiative with Age UK and is covering the gaps, supporting people who are in ED and ready to go home after intervention, but the package of care cannot be a start for different reasons, so it's like kind of the bridging gap. We have a hospital discharge home recovery scheme, does cleaning or purchase items that like new beds, which sometimes cause bed blocking in hospitals. And St. Barnabas Community Care Nurse Specialist for terminal illness, supporting people with terminal illness in hospitals. And as Claire mentioned, we haven't finished or signed off. It's going to the partnership board, the winter plan, and we will provide feedback further when it's been finalised. Thank you.
Thank you. Any questions from anyone? Councillor Bradwell.
Right, I've listened to what you've all been saying, but I understood that there had to be a children and young people's winter plan. And it's in the paperwork that the system says working together to deliver a resilient winter system's role and responsibilities. Children and young people. Winter plans should reflect the needs of local children and young people's population, with actions to place to manage pressures in the paediatric services. So if we don't know, could you let me know? You know, is our plan to send children off to Nottingham, to Children's Hospital there, or are we planning to look after our children here?
Glenn?
Thank you,
Yeah,
Chair.
I'm happy to come. Oh, sorry, I was going to say I'm happy to come in if you want me to, Councillor Woolley. Apologies, because I'm behind you.
Okay, Claire. Yes, you're just going to have to shout. Don't worry about it.
Sorry. My apologies for not being
if you
there
would
in
like to answer
person.
Councillor Bradwell, that would be absolutely great. Thank you.
Yeah. So what you've obviously not got in front of you is the detailed winter plan. What you've got is the expectations that will need to be in the winter plan. And absolutely, it covers all population groups, including children. So when I mentioned the acute respiratory infection hub, in particular, paediatrics is a big part of that. We saw lots of children going into ED with respiratory infections that could have been managed in the community. We've also got, as part of our demand and capacity initiatives, which were part of our plan for this year anyway, is a paediatric hub within ED as well over the winter months. So there are quite a lot of services that are very specific around paediatrics, but you would see that in the finalised winter plan. Some of those are actually in our plan for this year, so they're not new just for winter, if that makes sense. But absolutely, the plan is all population groups, including children. So whilst you've heard some of the things that we're doing that might perhaps be more around the frailty end, it absolutely supports the entire population. So no, we were not expecting our children to be going outside of county unless it's for specialist support that we don't provide in county already.
Are you? Yes, I was going to say, are you
No,
comforted
well,
by...
I just want to say it'd be good to see that in writing, because I always feel, and you might say I'm being a bit tetchy now, that, you know, it is all about older people, which it should be, and adults. We very rarely hear about children and young people, and there are some children and young people who are desperately poorly and will probably end up in A&E because of their health needs. So that's all I'm asking. You know, if we're looking at the whole population, that it should be the whole population.
Yeah, I'd agree with that. And when you see the finalised winter plan, you will see that. So all of the work that we're doing. So we know from the data and intelligence we gathered last winter, paediatrics was a big issue. And we know that particularly the acute respiratory hubs could really help with that. So absolutely, we recognise that. And you will see that when you see a final winter plan. Obviously, this is what the planning is for that plan, if that makes sense. So yeah, I'm very happy to pick up an offline conversation if that would be helpful, Councillor Bradwell too.
Claire, can you just tell me when do you hope to be able to share that, the plan in full?
So we're aiming to take that to the Urgent and Emergency Care Partnership Board next Friday. So that's the current timelines.
Okay, thanks very much. Would you be able to provide a link or something so that we can reassure Councillor Bradwell, you know, once it's completed, that we've got the children in there?
Absolutely, yeah, no problem. I'm happy to share it once it's
Thank
been
you.
approved by Partnership Board. There's no problem with sharing it, and I'm happy to come back if that would help.
Thank you, much appreciated. Any other questions at all? Councillor Rawlings.
Thank you, Councillor Rowley. Just on the point about infection prevention and control, you've got a bullet point there, so enabling visits between loved ones and care settings with at least one visitor permitted in all circumstances. But this is providers are expected to continue to follow the IPC guidance and local authorities to continue to support providers on IPC. Are any care providers allowed to overrule that, particularly in view of the issues that arose during the lockdown and the pandemic, which were fairly horrendous?
Claire?
I might look to Derek to support me with this one in detail, but
he's at the ready.
But how is he? Oh, I'm really glad about that, because Derek's team do a really good job of supporting, and all of the infection prevention control elements of the winter plan have come through Derek's team. So I'm sure Derek will answer probably better than I, so I'll keep quiet, shall I?
I'll try, Claire, and I've got Melanie behind me as well. We do have within every care home an identified member of staff who leads on IPC, and we train them via the health protection team in the county council. I think that's probably unique in the Midlands, if not the country. So we've got really strong relationships with each care home. Obviously, the nature of care homes are they are separate. They have to follow certain standards and procedures anyway in terms of the registration, but we provide that further advice and support and training. Generally, through COVID, we had a really strong relationship, and we saw that with the first wave of COVID discharge from hospital, where we didn't actually go with the national policy. We implemented a different policy in Lincolnshire. We're pretty sure that protected a lot of our care home residents. It's something we're ready for. We're not expecting COVID or indeed flu to have the same impact, but any infectious disease in a care home is obviously highly contagious and highly risky. So we provide a high level of support there. Happy to pick that up outside of this meeting and go through the detail. It will be captured in the full winter plan, and Natalie is part of that group, who's the head of service for infection prevention control.
Thank you, Derek. Melanie?
Thanks, and I would agree with that. I think there are one or two very large providers who have care homes in the county who may struggle because their national guidance may be different than ours. But what we've always done in this county since COVID started is, if Derek and Natalie's team said one thing and the national guidance said something different, we didn't read the national guidance, we followed what was said locally. And I think all of our care homes do that. I have to say, apart from if you're part of a very large organisation, you sometimes have to follow that. But and I think that's kept people safe, but also allowed loved ones in, because I think they're both equally balanced.
Thank you, Melanie. Councillor Rawlings.
To come back, Councillor Rowley, Glenn very kindly enunciated some of these issues at the audit committee on Monday, in terms of perhaps Lincolnshire is very fortunate that we have a diverse market in terms of our provision of care homes, but looking to the future, the large providers don't always provide that care that we would, that as an individual you would hope for.
Okay, did you want to comment on Councillor Rawlings' question?
Yes, thank you, Chair. So local government around the country doesn't look the same, of course, and our geographies, our contexts are materially different. One of the things about the local market in Lincolnshire for social care is that it's very much a distributed model, which suits a very highly dispersed community with small population groups who would prefer something local than bigger and farther away. Thank you.
Thank you, Glenn. Okay, Emma.
Thanks. It was just an observation and maybe something for us to think about in advance of next year, sharing this with some of the VCSE sector colleagues. I think there obviously has been some engagement with Age UK and St Barnabas, but LVET in particular are really keen to have wider engagement at an earlier stage of the process, because I think the VCSE sector could probably be, you know, in terms of the point around maximising the role of partners, there's definitely appetite there for people to be engaged in this process earlier on. So it's an offer of help, maybe for next year, but certainly if there's any short-term actions that we could pick up this year, we'd be happy to help.
Thank you, Emma. Much appreciated. Michelle?
Just to pick up on Emma's point there, I've joined that group on behalf of the council, and I know I'm talking to colleagues in the ICB also about how we can ensure links, so we'll pick that up outside the meeting.
Thank you. Any other questions? Okay, if we can move to the action required, which is to note the contents of this report. Could you raise your hands if you're in agreement? Any against? Any abstentions? Thank you. Move on to item 8, which is the integrated care strategy, the update and next steps. And this is to receive a report from you, Michelle, and is Pete? Yeah, we've got a double act. Thanks very much. All right.
Yeah, hopefully we've got a presentation going up. Yeah, it's up.
Can everyone see that online?
Thank you. So this is just to give an update to the committee or to the partnership board in where we are with our integrated care partnership strategy. For those, just to give the context, we had guidance in July 2022 that set out the needs for each integrated care partnership to develop a strategy, which we did. It was an interim strategy, had to be published by September, and we ran a number of workshops and had a number of steering groups to help shape that, and I'll quickly go over what was included. We're now expecting, so it was an interim strategy which we published. We're now in the process of kind of reviewing it, editing it, to finalise it, hopefully by the end of March next year. Expectation is there will be guidance coming out this month. We're yet to receive it. With bated breath, hopefully it will come out by Friday, give us all something to read over the weekend. But yes, so we haven't heard anything on that, so it's likely that it might not come out, but we're going to move forward in terms of developing our strategy. So I'll just quickly go over the next few slides fairly quickly, and I'll take the paper as read and some of the details in there. But just to confirm, when we developed the strategy, we developed an ambition, so if we move on to the next slide, please, which was for the people of Lincolnshire to have the best possible start in life and be supported to live, age and die well. And that is now encompassed in the new Joint Health and Wellbeing Board strategy, as well as the ambition in that. And it's also the same as in the Joint Forward Plan within the NHS, which sets out our 5-year priorities. We also adopted the shared aims of the Joint Health and Wellbeing Board strategy, which are above rather than the 4 core purposes of an ICS, because these have gone through an engagement process with the local population and were localised to Lincolnshire, so we kept with them, so they maintain within the document. So as we developed the strategy, our interim strategy had 5 priority enablers, which are listed there. They are population health, or they were, as stated at the time, population health and prevention, workforce and skills, personalisation and personalised care, community engagement and involvement, and data and information systems. So I won't go through them all in detail, but that's what the strategy entails, that we're aiming to work collectively together to help support our system address its health needs. So following that, we've then looked at, okay, what do we need to do to implement each of the 5 key enablers? We then developed a plan on a page, looking at what the kind of specific themes for each enabler, setting out kind of what our kind of approach would be on our priority. Got an overview of each of the enablers, understanding where their strategic context, aim would being that we'd tie in delivery of these enablers with existing kind of arrangements, identify where there are gaps and next steps, and proposed SROs going forward. And in doing that, we identified kind of some kind of developments we think we need to make in the strategy before we finalise it. So in terms of doing that work provided consistency in terms of what they all had, but identified actually there's some recommendations recommendations to update and amend some of the enablers, which I'll go through. Also to amend some of the themes within some of the enablers that we'll keep, but actually to kind of change kind of our thinking as we've gone through. Need to refresh some of the kind of strategy content itself, and also recommendations to strengthen the governance around how it's delivered and how we move forward. So I'm going to briefly, without going into too much detail, take you through what they are, and then happy to take any questions at the end. So on the population health and prevention, the key thinking in this one was actually that term led to confusion to people. So we're aimed really to, although the content was right and it was a golden thread, this kind of life cycle approach, which is in the Joint Health and Wellbeing Board strategy, or the refresh one, actually we wanted to amend the heading to be prevention and health inequalities, and support that work. Prevention and Health Inequalities Executive Group, which is on the agenda for the terms of reference to review and approve, in terms of having that group oversee this work and the enabler, and that group would be chaired jointly by Derek and also Sandra Williamson from the ICB, who is a portfolio executive for this area. So really the main change on that is changing the title, agreeing to the executive group's existence, who will then develop the kind of more detailed plan and take this forward, reporting back through to the partnership on how we're progressing that area. In terms of workforce and skills, the key bit here is we thought, as we reviewed it, was a bit generic in terms of we can't cover all workforce and skills across the entire kind of jobs across all sectors within Lincolnshire. So to reframe that to be focused more on the health and care sector, so to inspire young people to work in our health and care sector locally, and also collectively to take actions to address the skills gaps that we find in health and care. So that's the aim, is to amend the themes in this rather than the actual the key enablers, because we do recognise that workforce and skills is a key issue that we face in health and care within the local community, and therefore we still want to maintain that, but make sure it's focused. There's also a need to be minded of the devolution agenda, because there's opportunities that will come out of that with additional funding. The focus on the devolution kind of deal that will also help support this this enabler as we move forward. So personalisation and personalised care, there's a well-established board in place. We have an SRO from the third sector, Chris Reeway, who heads it up with a programme manager supporting that work. The aim is to have that personalisation board lead on delivery of this enabler and present back through into the partnership on its progress and its plans as we move forward. But realistically, this was led pretty much unchanged. So when we looked at community engagement and involvement, it was clear that this is very much dovetailed or almost overlapped with the Stronger Communities, the Lincolnshire County Council's Stronger Community strategy, and therefore didn't add much value being included in the interim strategy or to be in the finalised strategy. So the proposal here is to remove that as a priority enabler. And as we get on to priority enabler 5, split these two out, so we have a priority enabler on digital and how digital can support health and care sector in providing care to our communities. And that is really your wearables, it's the technology that actually will help the care professionals in providing care and monitor patients. So that's the expectation. So the aim is to take this on. If we go to the next slide, please. If we accept this as a new enabler on digital and technology, we've got some outline kind of 3 themes there that we want to scope out and develop at the early stage at the moment. So they are any kind of initial kind of thinking in this area, but actually this would be the new enabler 4 to focus that kind of digital and technology. What does that mean for Lincolnshire? How can we utilise that? Certainly as a rural county, we know we have digital access problems, but also if we overcome them, that is a way to address some of the workforce and geographical kind of challenges we face. And then finally on to the next one. And therefore, that therefore impacts on enabler 5, which had an overlap between digital and data. So this is to make sure it's about how we use our data, how we kind of use our data to support our healthcare professionals in the care they provide by having access to records, but also in terms of planning our care and planning our interventions going forward. So we are looking to revise the themes as outlined there, their initial findings at the moment in time. And as we develop this, we'll kind of work up the narrative and the more detailed plans that sit under this enabler. So they're the recommendations. They are right in the paper. So the next slide is around that. The next phase really is to now work on these, if in agreement to these recommendations, to work through these over the next 6 months, bringing them back to bringing the revised interim strategy, an update in December, as I understand it, and then the kind of more detailed strategy to be signed off March next year. Thank you.
Thanks, Pete. Anything you'd like to add, Michelle? Okay, any questions, anyone? No, looks like you're getting away with that fairly lightly. But, oh, Heather.
Just really quickly, because also I think when people have spent such a long time on something, it is good to have the feedback. So I really like the changes. I particularly like the changes that really focus us down and make us specific. So the bit about encouraging young people to stay and work in Lincolnshire in the health and care sector, that gives us something really tangible and a separate function from the LEP and all the other careers advice we do for young people. It gives us a real drive around the health and care sector. So I really like that, and I like the themes that you've broken down the health prevention and inequalities into. So I think it's a really good piece of work, and I think you can see the evolution of this plan to a much more specific, targeted approach, which I think really it really is to be commended. Thank you.
Thank you, Heather. Emma.
Thank you. It's just a point of clarification, because I know Michelle's been to the VCS Alliance meeting, but in terms of the wider VCSE sector, I think I'm not sure how clear we've been on the fact that this community engagement involvement priority is being taken away. I'm not sure that the Stronger Communities Lincolnshire Community Strategy has yet got any traction, and therefore I would just like clarification about when it talks about engagement with partners, has this kind of been formally discussed at the VCSE Alliance? And apologies if it has, Michelle, but just for my clarification, because I feel like I need to feed back to colleagues on that point. Thanks.
Thank you. So as part of the work we've done over the last 6 months, I have presented to a number of forums, and what we intend to do is work with my colleague Lisa Defield and Ben and other colleagues within the voluntary sector in order that we embed the community sector and also the value of our communities and the diverse nature of our county right from the outset. So really refocus the introduction and the overview and the context within this document in order that it's refined. So although we're taking it out as an enabler, there'll be a key thread all the way through from start to finish, because in each one of those enablers, the voluntary and community sector play a vital role in delivering, helping us and supporting us to deliver that. And so just to give you assurance, when we come back with our update, there'll be clearer guidance on how we're going to incorporate that as we go forward, and I'll carry on working with the sector on that.
Thank you, Michelle. Derek.
Yeah, I think Emma makes a really good point about how best to engage with what is a huge and disparate sector. It's something that we've been having in conversation at Better Lives Lincolnshire leadership team, so that's the chief execs level, and just because we've taken it out as sort of a narrative within the enabler doesn't mean it isn't still a top priority. As you mentioned, we've got LVET, and that's one way, and seats around that table, but we've got to find another way, as Michelle was talking about, to engage the sector in the strategic, the tactical and the operational delivery of all of the programmes and projects that are going to come out of this. And so that's ongoing work that we'll carry on with, and obviously through you and through partners on Better Lives Lincolnshire who represent the sector, we'll need to work that up.
Thank you, Derek. Any other comments or questions? Okay, can we move to the actions then? And I just propose to say action 1, which is the changes to the various enablers, and then action 2. If you're all in agreement, will you raise your hands, please? Any disagreement? Any abstentions? Okay, thanks for that. We now move on to paper 9, which is the Prevention and Health Inequalities Executive Group. And I understand this is a presentation from you, Derek. Thank you.
Thank you, Councillor Worley. I'm just going to pull out the salient points from the paper rather than a presentation as such. But just to go back a step, we were talking earlier on this afternoon in the Health and Wellbeing Board about the refresh for the health and wellbeing strategy. Pete's just talked about the integrated care strategy. To some extent, they're two sides of the same coin. And I think whilst this looks quite governance-y, it's actually an articulation of something that's probably quite unusual in systems, which is where we're going to is to have one approach for prevention and health inequalities at a system level that brings together all of the work that the NHS is being driven to do in this space by NHS England, the Department of Health and Social Care, all the work that we do as a council, as a county council, as district councils, as partners, through our statutory responsibilities in this space, trying to pull it together so that we are going together in one integrated way, albeit with lots of different programs and projects. So whilst it looks quite governance-y, I think it's a really good example of where we've moved quite quickly, at least in NHS and council terms, to bring together disparate areas under one approach. The paper outlines, and Pete's really covered a lot of the governance side of it. This is one of the key enablers. We've changed the language so it's around prevention in a broader sense. Health inequalities obviously is a statutory responsibility and a key driver for everything we do. But prevention, especially from an NHS perspective, is the only way we're going to deliver. I think Andrew had said earlier on in the Health and Wellbeing Board session, if we keep doing what we've always done, we're just not going to be able to achieve. That doesn't mean we're going to completely close hospital beds and wards and hospitals in totality, but we do need to intervene earlier in the prevention side for people who've got existing conditions, as well as stopping them get conditions in the first place. And the whole point of the Prevention and Health Inequalities Executive Group is to bring all of that work into one place. It sits under the interim strategy, and as we develop that and finalise that, it will be a core delivery group and feed through here, but it'll actually also feed into the Health and Wellbeing Board, depending upon the programme of work that we're doing. The background is it fits within the four themes. So we've got preconception, infancy and early years as one, and childhood and adolescence as the second. So half of the programme is around children and young people, because clearly from a prevention and health inequalities focus, that has to be a core area of work. Equally, we've got to make sure that our older population, and we have a predominantly older population in Lincolnshire, we're doing everything we can for people who've got existing conditions to stop those conditions getting worse. So two sides of the same coin. I won't go through the details of the terms of reference. Hopefully everybody's had a chance to look at those. I really see this as a starter for 10, really, in terms of the terms of reference, and we will evolve over time. We also are looking to use this as a standard model across all of the different key enablers that Pete's just run through as well. So this is the general approach, and we've already had that conversation in terms of one or two of the other key areas as well. That was all I was going to say on this one.
Thank you, Derek. Any comments or questions to Derek at all? No? As you say, good start for 10, wasn't it? And is it something I can blag about when I see this minister then, that we're grown-ups and we can put all these bits together then?
I think you will do that excellently.
Thank you for that. That was the right answer. Can we move to the actions required, which are at the bottom of page 65. I won't read them out, but action 1, action 2 and action 3. Can all those in favour raise your hands, please? Anyone against? Any abstentions? Thank you for that. We move to our final paper, which is the forward plan, and this is merely for noting. However, if you do have any items that you would like to bring forward, then please make Alison aware, and we'll make sure that we, or Pete, or Michelle, that we'll make sure that we get them included. And I would just then like to thank you all for coming and wish you a safe journey home. Thank you.
Thank you.